All right, so I'm here today with Dr. Preston Fogle. We're here at Spalding Regional Medical Center and Sylvan Grove Hospital down in Griffin, Georgia, and we're on our third day post-go-live of the implementation of the Cerner Millennium product. So, Dr. Fogle, how are you today?
I'm doing fine, thanks, Charles.
All right. So, I got a series of questions I want to ask you to kind of gauge your involvement and your insight on the importance or the significance of the electronic medical record that you all have put into place. So, my question number one is going to be, why is it important for executive leadership to really be involved in large healthcare IT projects?
Well, I think that's a very good question about the success of a project. The concern about how important an issue is in a hospital really has to come down from the administration to not just the nurses but the physicians involved in the hospital. Whether you're in a teaching institute or in a hospital where you have a community base of physicians that utilize the hospital as part of their care delivery, what the hospital administration feels about a project, the importance of it, the focus on it, really affects their response to getting involved in trying to carry out the project.
Okay. That sounds really good. Now, and my second question would be, what were some of the strategies that you used to really get the physicians involved in the IT project?
That's especially in a community system. That is the task. That's the daunting task. You have to realize that as practicing physicians, these guys are involved in delivering care to patients, not just in the hospital, but majority of them are involved in their office.
Okay.
Probably 95% of their day is spent outside of the hospital system. So to get them to focus on that 5% is hard to do. Now, it's an integral 5%. They have to take care of those patients in the hospital. They have to make rounds in the morning and do things. But getting them to focus in on that part of their daily activity, it was the challenge.
Okay.
But once they realize that, one, in their particular practices, the patients that are admitted to the hospital are usually the sickest ones. That's why they're in-house. And two, that they needed to have some way to get involved in this project to learn how to utilize this system so they can better take care of their patients. So what I did, even before we started going live, went out and started talking with them. I presented it during the course of the year coming up at every meeting, at each departmental meeting on the MEC. When we talked to credentials, I attended the subcommittees they were involved in, so I could let them know this was coming and what it was about, sort of planting the seed at that time. And then as we got closer and closer, giving them a little bit more detail about the project. And I think Tenet did a very smart thing by phasing this project in, with this first round of developing the EMR itself, getting the nursing activity and tasks being done on the system and the documentation on the system. But allowing the physicians to be involved in that process was very smart, because now the doctors are able to visualize the chart, see what's going on. They still have a paper chart for the documentation part, but they actually can view the details of the patient's record on the EMR. And that sort of gives them a stepwise progression into the utilization. Rather than it all been dumped on them at one time, they have time to get used to this part of it.
Okay. My third question is what was the relationship between nursing as an industry and physicians? How would that nursing buy-in help facilitate physician utilization of EMRs?
Well, you have to have strong nursing care. The nursing care is the backbone of what we deliver to patients. So when you have nurses that are engaged and interested and wanting to advance, then that really helps stimulate the doctors to do so. The relationship you have between your nurses and your physician is very important. It's good to have a strong bond between those two people. And so these are the ones that the doctors depend on the most. These are the ones the doctors trust the most. These are the people that the nurses respect and want to utilize. And so when you have that relationship that's in place and they trust each other, if it's something that's important for the nurses, it becomes relatively more important for the doctors. Okay. So I think that's the key thing to it, is that because the nurses drive the actual care of patients in the hospital, for the physicians to have that association with them makes them buy into any project that they're trying to undertake. I can give you a great example. The reason this hospital has such good understandings on core measures and congestive heart failure readmissions and skip measure protocols and DVT prophylaxis. It's not necessarily because the doctors focus on it that much, but because the nursing staff were well trained, focused on those issues, made them priorities, and that brought the doctors along in performing those activities more properly. And so it makes the doctors look good. And that's the same thing that happens with electronic medical record system. You have your nursing staff well trained. They know how to utilize the system. Patient care delivery improves. The physicians jump on board and continue to use that process.
Excellent. So my last question for you is slightly broad, but it requires you to give me some insight on what we're doing futuristically. And that would be, how does round one, the basic elements of an electronic medical record being implemented, affect the round two portion of the impact project that you're working on, which would be computerized provider order entry?
Like I alluded to earlier, I think that is one of the smartest things that Tenet did in this process, phasing these projects in. By establishing the electronic medical record system first, letting the nurses get comfortable with utilization of it, but the physicians get comfortable with utilizing the visualization of their records to a certain extent. It gives them a prelude to the CPOE, and it gives them a chance to get used to the system, how it works, how it functions, some of the intricacies of the product itself before they have to learn how to deliver the order set entries. I think another thing that helps with that is having some standardization of the orders as you go into that phase. If you already are used to using standardized order sets, then that helps you get used to developing those standardized order sets when you get ready to do your CPOE. But definitely spending some time with the system, visualizing certain components of data within the system before you have to learn how to use the whole thing is a big help.
Okay. So, with lessons learned, if you could give advice to a physician champion going forward on a project of this magnitude, what would be your initial advice for him in promoting the change strategy piece?
Get engaged early. When we think about these projects as physician champions, we mainly think about the physician portion of it. So a lot of times you're not really as focused in on round one as you are on round two, where we actually get physician training, physician involvement, physician utilization of the system. But by being involved in the developmental process of it, you gain a much better understanding of the project itself. You also give the physicians better data and information so they have better prep for going live with CPOE. You're getting engaged as early as you can in the first round, understanding what the nurses are going through, attending some of the super user training, some of the end user training, getting involved in those processes, get involved in the policy and procedure development, get involved in how they go about doing the CPIC data and knowing what issues are affecting the nurses. Then you can sort of better gauge how to deliver those same type of things to your doctors when you have to. If you wait until round one's gone and you're sort of into that for several months and then start to get the doctors engaged more, they're not going to have as good a buy-in if they understand the process better. And as a physician champion, the more you understand about the technical part of it, the better you can deliver the patient care part of it, because you understand how that product works to deliver the best care to your patients.
Well, Dr. Fogle, I thank you very much for your time. I'm sure we'll be speaking with you again. Any parting shots for the rest of the Tenet families who will be seeing you?
Tell everybody I say hello and thank you for all your help. I think that you didn't ask the question, but I tell you the other important part of this project is having good support people. So, people like yourself have done it before, know the product, know how to do it, know how to interact with physicians. Because the physician interaction and comfort level is the most important thing. The nursing process is there, because that's where the workflow comes through. But you have to understand and engage your physicians, because they're the ones that are going to sustain your product, use it, adapt it, and sustain it. Okay, even if the nurses like it, the physicians don't like it, don't want to use it, uncomfortable with it, it's not going to last. So you really have to have people around that are willing to engage the doctors. And you have to have a good product. So I think Tenet's done a great job of picking Cerner as a partner in doing this. And this product itself is so good that it's intuitive. You can use it. It's adaptable. And so if you have a good product, and you have good support people for that product,
Yeah.
and you have good people support like you guys,
Yeah.
then you got a win-win.
Thank you very much, Dr. Fogle. We look forward to speaking to you again.
All right.